The recent news about Valsartan recalls has left many people confused and concerned. Valsartan is a popular medication used to treat high blood pressure and heart failure. However, several manufacturers have recalled their products due to the presence of a potentially cancer-causing substance. This has caused widespread panic and misinformation about the safety of Valsartan. As a result, it's essential to separate fact from fiction to understand the truth about Valsartan. In this video, we'll take a closer look at what Valsartan is, why it's been recalled, and what you need to know to stay safe. We'll also explore the alternatives available and provide expert advice from medical professionals to help you make informed decisions about your health. So, whether you're a long-term user of Valsartan or considering it as a treatment option, read on to get the facts and dispel any myths about this widely used medication. What is Valsartan used for? Valsartan is a medication used to treat high blood pressure and heart failure. It belongs to a class of drugs called angiotensin receptor blockers, ARBs. Valsartan works by blocking the action of angiotensin II, a hormone that narrows blood vessels and raises blood pressure. By blocking the action of angiotensin II, Valsartan helps to widen blood vessels and lower blood pressure, which reduces the risk of heart attacks, strokes, and kidney problems. Valsartan is often prescribed as a first-line treatment for high blood pressure and heart failure. It's also used in combination with other drugs to treat certain types of heart failure. Valsartan is available in tablet form, and the dosage may vary depending on the individual's condition and response to treatment. Despite its effectiveness in treating high blood pressure and heart failure, Valsartan has been at the center of controversy due to recent recalls. The Valsartan recall. The Valsartan recall began in July 2018 when the European Medicines Agency, EMA, announced that some Valsartan products contained a substance called N-nitrosodamethylamine, NDMA, which is a potential carcinogen. NDMA is a byproduct of industrial processes and is found in small amounts in some foods and water supplies. However, it's not intended for human consumption and can be harmful if ingested in large amounts. Several manufacturers of Valsartan products, including Teva Pharmaceuticals, Major Pharmaceuticals, and Solco Healthcare, recalled their products due to the presence of NDMA. The U.S. Food and Drug Administration, FDA, also issued a recall of Valsartan products in the United States. The recall affected millions of patients worldwide who relied on Valsartan to manage their high blood pressure and heart failure. The recall also caused widespread panic and confusion about the safety of Valsartan, leading to many questions and concerns about the effectiveness of the medication. Why was Valsartan recalled? The recall of Valsartan was due to the presence of NDMA, which is classified as a probable human carcinogen based on animal studies. The World Health Organization, WHO, considers NDMA to be a potent carcinogen that can cause cancer in humans. NDMA can be formed during the manufacturing process of Valsartan, particularly when certain solvents are used to make the medication. The FDA and other regulatory agencies around the world have established limits on the amount of NDMA that can be present in medications, including Valsartan. However, some manufacturers may have used contaminated ingredients or improper manufacturing processes, leading to the presence of higher levels of NDMA in their products. The presence of NDMA in Valsartan products led to concerns about the potential health risks for patients who had been taking the medication. While there have been no reports of cancer or other adverse effects from NDMA exposure in Valsartan users, the long-term effects of exposure to NDMA are not yet fully understood. The impact of the recall on patients and healthcare providers. The Valsartan recall has had a significant impact on patients and healthcare providers around the world. Patients who were taking Valsartan were advised to stop taking the medication and contact their healthcare provider for alternative treatment options. However, many patients found it difficult to switch to other medications, particularly if they had been taking Valsartan for a long time and had achieved good blood pressure control. The recall also caused a shortage of Valsartan products, which made it difficult for healthcare providers to find alternative treatments for their patients. Many patients had to switch to other medications, which may have been less effective or caused more side effects. Healthcare providers were also affected by the Valsartan recall, as they had to spend more time and resources finding alternative treatments for their patients. They also had to deal with the increased anxiety and concerns of their patients about the safety of Valsartan and other medications. Alternative medications to Valsartan. If you are taking Valsartan and are looking for alternative treatment options, there are several other medications that can be used to manage high blood pressure and heart failure. These medications include Losartan. Losartan is another ARB that works in a similar way to Valsartan. It's also available in tablet form and can be used to treat high blood pressure and heart failure. Losartan has not been affected by the recent recalls and is considered to be a safe and effective alternative to Valsartan. Candesartan. Candesartan is another ARB that can be used to treat high blood pressure and heart failure. It works by blocking the action of angiotensin II, similar to Valsartan and Losartan. Candesartan is also available in tablet form and has not been affected by the recent recalls. Lisinopril. Lisinopril is an angiotensin-converting enzyme, ACE, inhibitor that can be used to treat high blood pressure and heart failure. It works by relaxing blood vessels, which helps to lower blood pressure. Lisinopril is available in tablet form and is considered to be a safe and effective alternative to Valsartan. There are other medications available to treat high blood pressure and heart failure, and your healthcare provider can help you find the best treatment option for your individual needs. The benefits and risks of Valsartan. Despite the recent recalls, Valsartan is considered to be a safe and effective medication for the treatment of high blood pressure and heart failure. Valsartan has been extensively studied in clinical trials, and the results have shown that it can help to lower blood pressure and reduce the risk of heart attacks, strokes, and kidney problems. However, like all medications, Valsartan has potential risks and side effects. The most common side effects of Valsartan include dizziness, headache, and fatigue. In rare cases, Valsartan can cause serious side effects, such as liver damage and low blood pressure. It's essential to talk to your healthcare provider about the benefits and risks of Valsartan and any other medications you may be taking. Your healthcare provider can help you make an informed decision about the best treatment option for your individual needs. Valsartan lawsuits and settlements. The Valsartan recalls have led to several lawsuits and settlements against the manufacturers of the medication. Patients who were affected by the recalls have filed lawsuits claiming that the manufacturers were negligent in producing and distributing contaminated products. Several manufacturers, including Teva Pharmaceuticals and Solco Healthcare, have settled lawsuits related to the Valsartan recalls. The settlements have included compensation for patients who were harmed by the contaminated products. The lawsuits and settlements highlight the importance of ensuring the safety and quality of medications and the need for manufacturers to take responsibility for their products. Conclusion: what you need to know about Valsartan. The recent Valsartan recalls have caused widespread panic and confusion about the safety of the medication. However, it's important to separate fact from fiction to understand the truth about Valsartan. Valsartan is a safe and effective medication for the treatment of high blood pressure and heart failure. However, several manufacturers have recalled their products due to the presence of a potentially cancer-causing substance. If you are taking Valsartan and are looking for alternative treatment options, there are several other medications available that can be used to manage high blood pressure and heart failure. It's essential to talk to your healthcare provider about the benefits and risks of Valsartan and any other medications you may be taking. Your healthcare provider can help you make an informed decision about the best treatment option for your individual needs. The Valsartan recalls highlight the importance of ensuring the safety and quality of medications, and the need for manufacturers to take responsibility for their products. By staying informed and working with your healthcare provider, you can make the best decisions about your health and ensure that you receive a. Thanks for watching.